When I first got prostate cancer, like everybody else, I didn't talk about it. It's like a private club where nobody wanted to be a member and nobody wants to talk about being a member. The symptoms I started to feel were very general. And I started to notice I had a little bit more backache than normal, maybe a little tired. I did notice that I was kind of winding down for some reason. When I went to my doctor to have my yearly physical, she did a prostate exam. Everything seemed, she said, oh, it's fine, a little swollen, but we should run a PSA test to make certain it was okay. And that's when it came back. It was kind of high. So she suggested I see a urologist. I had stage 4 prostate cancer. My wife, Chris, has been a major support through all this. When I was first diagnosed, she insisted that she be with me every step of the way through every doctor's visit. She'll say, well, what shot is he getting today? What are you doing? Tell him about this little episode or that little episode, So she's like my traffic cop a little bit, She keeps a close eye on me. It really helps. I'm extremely grateful to her for all the help that she's given me during this time. I've been on the hormone therapy for about 3 years when I noticed that my PSA was starting to rise. We began to discuss, why was it rising? My doctor added another drug to that hormone regimen, and it started to rise a little bit more. And that's when we started talking about Xtandi.
Xtandi, enzalutamide capsules, is a prescription medicine used to treat men with prostate cancer that no longer responds to a medical or surgical treatment that lowers testosterone and that is spread to other parts of the body.
My doctor said Xtandi might help slow the progression of my cancer. We discussed some of the possible side effects like hot flashes and fatigue. I do have some side effects like bone pain and hot flashes, to name a few. My doctor and I are very pleased with our results that I'm receiving from Xtandi. Not having to take it with a meal is really nice because I don't have to think about, I've got to take this with dinner and, now dinner's at 8 o'clock or 9 o'clock, or 5 o'clock in the afternoon. Men need to talk about prostate cancer. We need to be more active in our care. We need to get our message out there that we have cancer and that we're not afraid of it and it isn't the end of the story and life goes on, and that there are medications and therapies that will help you. I'm grateful for the results I've seen and for the people who've helped me get there.
Xtandi is a prescription medicine used to treat men with prostate cancer that no longer responds to a medical or surgical treatment that lowers testosterone and that is spread to other parts of the body. Xtandi is not for use in women and children. Do not take Xtandi if you are pregnant or may become pregnant. Xtandi can harm your unborn baby. If you take Xtandi, you may be at risk of having a seizure. Before taking Xtandi, tell your doctor if you have a history of seizures, brain injury, stroke, brain tumors, or any other medical conditions. When taking Xtandi, you should avoid activities where a sudden loss of consciousness could cause serious harm to yourself or others. If you take Xtandi, you may be at risk of developing a condition involving the brain called PRES. Tell your doctor right away if you lose consciousness, have a seizure, or have quickly worsening symptoms such as headache, decreased alertness, confusion, reduced eyesight, blurred vision, or other visual problems. The most common side effects of Xtandi include weakness or feeling more tired than usual, back pain, constipation, joint pain, hot flashes, and high blood pressure. Xtandi may cause infections, falls, and injuries from falls. Xtandi may interact with other medicines, so tell your doctor about any other medicines or supplements you are taking. Take your prescribed dose exactly as your doctor tells you to. Swallow Xtandi whole. Do not chew, dissolve, or break open Xtandi capsules. These are not all the risks and side effects associated with Xtandi. For more information about Xtandi, visit Xtandi.com. Ask your doctor if Xtandi is right for you.